Hey everyone, Justin Holland here for the Mad Insurance Show, making a difference in insurance. I'm Justin Holland with Texas State Insurance Services and Palmetto Life Group. This is going to be a show where I'm going to kind of go over some articles again, some news going on in the industry, and then I'm going to dive into some stuff that I think a lot of shows or industry brokers really don't dive into, and that's going to be ICHRA. I'm going to talk about that here shortly as well, and then I'm going to talk about Medicaid and how that relates to insurance, specifically health insurance into the Medicare segment. So I can't thank you enough for joining us. You might be watching us online through our YouTube channel. If you go to youtube.com/at Mad Insurance Show, you can like and follow our shows and episodes there and short clips that we share online. So we'd love to have you watch us online if you don't have a chance to watch the whole show here or catch up on other episodes from the past. This is actually our 24th episode, I think, that we're recording today. But if you need help with health insurance, and if that is Medicare for those that are eligible for Medicare, individual health insurance through the marketplace, if you need help with individual coverage options outside of the marketplace, or even employee benefits for your valued employees and your company, give us a call at 210-880-5316 or visit us online at txstateinsurance.com. We're very well in tune with individual health, the small group plans, and how that dynamic can change and adjust for everybody. So just let us know if you have any questions. And again, Texas State Insurance Services, 210-880-5316. Or again, visit us online at txstateinsurance.com, and we can help you out with everything health insurance, employee benefits, even travel insurance, dental, all of those options. The other agency that I want to bring up real quick that I oversee is Palmetto Life Group. Palmetto Life Group specifically goes after and engages for the life insurance, long-term care plans where individuals need that long-term care coverage. I've talked about long-term care a lot on prior shows. We also help out with Social Security analysis to complement your retirement, as well as retirement options. But we've also joined and offered multiple carriers on auto, home, and commercial lines. We have quite a few carriers that we can keep your current coverage honest and do a quote for you if you need that for your personal lines of auto, home, and even commercial and umbrella lines if you need it. The number to reach us at Palmetto Life Group is going to be 877-357-5316, or you can visit us on the web at palmettolifegroup.com. So without further ado, I like kicking off every show with some updates. Now, I pre-record this show typically the day before it airs online or airs on the local KTSA radio station here. And I like to make sure that we're in tune and update our audience and our clients and everybody that's listening with what's going on as it relates to the industry. And most of the news that I bring up is typically for health insurance. So let's talk about one that just popped up within 20 hours online, and it's regarding an insurance carrier, Providence. And Providence actually has a good market in the deep South Texas area, specifically the Rio Grande Valley, which we service quite a bit for in the health insurance industry. So this surprised me. In an internal email to staff, Chief Financial Officer Greg Hoffman said the organization's top priority is continuity and stability. Providence is looking for a buyer for its insurance subsidiary, Providence Healthcare, the organization announced on yesterday. So Providence is headquartered in Washington State. Providence sells many kinds of insurance products. I just know them really specifically on their Medicare Advantage plans that they offer. But it looks like they do offer employer plans, individual and family coverage for the Affordable Care Act in select markets as well. There's been some signals over the last few years that the insurance division could get cut or spun off as a part of reorganization. I brought this up earlier this year in a few of the show episodes. I am not gonna be surprised if we start seeing consolidation with the insurance carriers, okay? And basically, they're merging within each other on some of these aspects. You had Blue Cross and Cigna a while back, to have that acquisition that came in. I think it was Humana and Aetna years ago tried to make that work, and they just got shot down. They were gonna be too big, I believe, for that. But this news on Providence Health, I mean, I am not surprised. I think we're going to see more of this coming. If these carriers want to continue offering these plans, they're going to need to possibly need more capital or more backup and support from maybe larger carriers that can take over their business. So that was interesting to see. Providence Health. If you've got a Providence Medicare plan, that's good to know. Just know that there could be some changes there with that carrier, and we'll see how that plays out. A couple of other articles that I came across for the show. Let's talk about this PBS article. The Many Americans plan to cut food to afford ACA health insurance. The new poll shows. Let's dive into that real quick. Um, that's a big, headline right there. People are skimping on food right now so they can keep their health insurance in place. I've got a large demographic of clients, where we've got a little bit lower income, we got middle class, upper middle class, and those that have done really well financially, and everybody's complaining about the cost of health insurance. It's not just the individuals that can afford it; it's the individuals that can't afford it as well. And many Americans plan to cut food to afford ACA insurance. New poll shows that's a problem, if that's the case. And we all know that the junk food and bad food for us is typically more affordable. It doesn't help if you're trying to eat healthy and having to pay more for your insurance and pay more to have a healthy diet as well. Let's dive into this. This is lately Priscilla Brown. This is an AP story out of New York. Lately, Priscilla Brown has had to choose between properly managing her type 2 diabetes and affording other necessities like gas for her car. Some days she takes off a half a third of prescribed insulin dose just to stretch it out. That's a problem. And I've seen clients do that we've helped get insured, and sometimes they can't afford the medications, or they try to stretch those medications, which could in fact affect their health. And we don't like to see this. Keep on going on this article. Sometimes I don't even take my medicine, said the 48-year-old truck dispatcher in Orlando, Florida. It's just too much with my insurance. It's crazy. About 8 in 10 Americans like Brown who re-enrolled into the Affordable Care Act marketplace coverage say their health care costs are higher this year, including about half to say the costs that are a lot higher according to a new survey. I am seeing this real time. I had a call first thing this morning of another client saying, "Hey, Justin, this $350 premium is just not working. I can't make it happen. What other alternatives do I have?" And that's a problem. And there's nothing we can do about it. A lot of individuals that need this health insurance aren't, because of the Affordable Care Act, pre-existing conditions don't apply. There's no underwriting. I can't get them on the alternatives that they would have access to. Now, those that are healthy, nothing going on, they just want to have stuff in place for accident and sickness. We got you covered. We've got some health coverage options to help you out with that. However, when we dive into the Affordable Care Act, these premiums have just spiked on everybody, and some of these carriers are more expensive than others. For example, Blue Cross Blue Shield probably had the highest rates out of everybody for individual marketplace plans, specifically Central South Texas, probably all of Texas. But in our market here for San Antonio and surrounding areas, as well as South Texas, Blue Cross had some of the highest premiums. So some of our clients didn't have the ability to switch because they needed to continue seeing some doctors that were in network with Blue that weren't in network with those lower cost other carriers. So there was some tough decisions being made. Some of our clients were like, "Hey, not a big deal. We'll switch doctors. You know, if that's what it's going to take to continue with health insurance and make sure that they've got coverage in place and they have that peace of mind, they had to find a new doctor. For some individuals, they've been with these doctors for 10, 15, 20 years. Some of these doctors have saved their lives and they want to not lose that relationship. And don't get me wrong, many doctors are retiring and you're not going to have a choice but to change doctors. But no doubt it's caused a disruption off of that. So this is another sobering article. Many ACA enrollees are anxious about medical costs. You know, that's everybody out there. Last year, Brown, this client that they're talking about online, paid $0 towards her health insurance premiums. This year, her plan costs $17 a month with a high deductible. Okay. Brown learned that she would, this week, that her new refill of medication was going to cost her an extra $150. This is a good point on this article that I'm bringing up here on the show, to reiterate that you might have a reasonable premium still on your individual health insurance. You know, $17, that's a manageable cost. There were many that had 0 premiums for last year and years prior, but if you're on that type of plan and it's a high deductible plan, there are deductibles that are linked to that for the prescription drugs. And you might have a higher tier medication that's going to be subject to a $500, $1,000, $2,000 prescription drug deductible that's baked into the plan. So that could be devastating. I mean, right here in this article, the lady was typically paying nothing for her medications and then had to go into a new plan this year, and that bumped up to $150. Okay. And that adds up depending on the medications. Couple other things they bring up in the article. Some enrollees switch to lower tier plans while others drop coverage entirely. I am seeing both of those with our brokerage. I've got individuals that we were able to switch to a lower tier plan within the enrollment period that ended in January. The last date to be able to change plans was going to be January 15th for a February 1st effective date. And some people didn't make any changes and they're stuck on those plans if they're with a more expensive plan. The only way we can help them with alternative coverage is if they would qualify. But most of last year's enrollees, about 7 in 10, stayed on ACA health insurance. But that includes 3 to 10 who have changed plans within the marketplace. So you've got people that just dropped out completely. You got people that modified their plan and hoping to stay on it. And then those that didn't modify their plan and just stayed on it. Those are finally, we're March 20th, we're 3 months in, and they are finally taking a look and taking stock and saying, hey, I just can't afford this anymore. That's scary. I'm hoping our legislatures are watching these articles and these stats and realizing the significant changes that people are going through regarding having access to affordable health insurance. It's a mess right now. Couple more things on this one article. They got some good information on this. Many enrollees blame health insurance companies and politicians. Okay. So everybody's angry and rightfully so because of what's going on. Again, 7 in 10 returning ACA enrollees facing higher costs say they blame the health insurance companies a lot, while just over half put a blame on Republican lawmakers, President Donald Trump, and pharmaceutical companies. About one-third blame Democrats in Congress or hospitals a lot, while 1 in 10 placed this level of blame on doctors or employers. So, my take on that part of the article is the fact that, yeah, I was hoping or optimistic that legislatures this past few months would have extended the subsidies for those that got extended subsidies a few years ago. They did not. They just said, hey, this isn't working. We got to start cutting this off. The problem is you left millions and millions of people in the middle class um, with exposure, higher premiums, and the fact that they just won't be able to afford a health insurance. So when you basically cut that off, And I totally get, hey, there was a deadline. This was a Democratic deadline that put in there. I understand that. But when people are struggling with the inflation that we've had, the higher gasoline costs that are here and that are coming, it looks like, with everything going on overseas, you know, I really feel and hope that legislatures can actually wave a magic wand and make things happen quickly. I've seen them do it in prior years with the Affordable Care Act, and they can do special enrollments. They can reinstitute, laws or criteria that they had in the structure of the Affordable Care Act. There's no question there needs to be some changes and updates, but what I've brought up on prior shows before is the Trump administration, when in office years ago, said, "Hey, listen, we're probably not going to dismantle this, but we're going to make it better." That remains to be seen. When we got hit with COVID, I was very disappointed that the administration at the time did not allow a special enrollment period for people that missed coverage or lost coverage or couldn't get enrolled to be able to get in there. And, when the new administration came in, they opened that up and they leveraged the expanding tax credits, and it helped a lot of people. I think one thing that caught them by surprise was all the Medicaid enrollments, and they were basically automatically approving and renewing Medicaid, and they finally scaled that back and caught back up with that. But I'm hoping that um, legislatures are working on this, but there's a lot of noise out there politically on stuff all over the place overseas, and I feel passionate. Yes, I'm biased. I'm in the insurance industry. We try to grow our brokerage with more health insurance clients and other insurance clients and or other segments of insurance clients. However, a lot of people are hurting. I I I handhold every one of these appointments in most cases, and it's exhausting. And a lot of times, the individuals that will call in, just this week, I kind of got beat up on the phone because they were like, "Well, what do you mean I can't get health insurance? What do you mean there's no other options outside of the Affordable Care Act that I missed an open enrollment opportunity on?" And they just don't know. And even 14 years being in this industry and having the Affordable Care Act for almost that time, people just don't realize the dynamics of group health insurance coverage that they might have been accustomed to for many years. The fact that they just didn't go insured and they just kind of assumed that they could get insurance whenever they wanted. It's just not the case. And we try to I say I try to reprogram the people that I talk to, but I try to educate them very quickly and say, "Hey, listen, guys, I know you might have the assumption of that there's just insurance options out there, but that's not the case. You've got specific areas where you can get coverage or insurance, and here are the options. Some of those options are very expensive. Some of them are reasonable, and they're good. But the biggest obstacle is getting a pre-existing condition covered, or not covered, the exposure that it would be on somebody for that. So it's that was a good few phone calls we had this week on individuals that just they were like, "Justin, I don't understand. Why are there not other insurance options?" And I have to let them know the sobering news and the exposure that they most always have because they're just calling in a little too late to fix their health insurance situation. A lot of times it's, hey, they got a medical situation going on, and they're like, "Well, why can't I get coverage tomorrow or today?" It just doesn't work that way. There are some options where you can get next day coverage, but you got to qualify, and it's going to be limited. You know, true health insurance. Let's just so we're crystal clear. True health insurance is typically or always on the Affordable Care Act, where pre-existing conditions don't apply. There's baked in coverage for that for maternity, for your annual physicals, mammograms, colonoscopies, the annual blood draw. That's health insurance. Okay. Health insurance is also a lot of times a small or medium or large group health insurance plan that you have through an employer. They are typically compliant with offering what would be deemed insurance for their employees. Some of them don't. They just offer minimal essential coverage, the bare minimum. But most cases, the employer's offering that. Anything outside of that is typically going to be health coverage outside of Medicare if you're Medicare eligible. But I'm talking the pre 65 market for those under 65 or family members and children of a household. So hopefully that helps, with a little bit of insight on insurance versus health coverage. If you got questions about that, give us a call. You're like, Justin, you were talking about health insurance and health coverage. What's the difference? Give me a call at the office. We'll have Lydia schedule an appointment there in house, either by phone or for video conference, or even have you stop by one of our 4 locations in San Antonio that we can meet at, or down in South Texas in McAllen for the Rio Grande Valley if that's needed as well. But the phone number for Texas State Insurance Services is 210-880-5316, or you can visit us online and fill out a contact form at txstateinsurance.com. So we're talking articles here. We're spending a little bit of time on this because I think this is good insight and news that we can share online and over to the radio listeners that are driving around the San Antonio area. This next article I came across, it was on CNBC. 9% of ACA health plan enrollees go uninsured after enhanced subsidies expire. Again, I'm kind of repeating myself here, but it begs repeating. 9% of ACA healthcare plan enrollees, almost 10, I don't know why they didn't round that up for whatever reason. It is that's a huge number. About 9% of those enrolled in ACA plans last year dropped their health insurance altogether, and an additional 17% are at risk of doing so because they can't afford the new premiums. So we are looking at over a third or over a quarter of the enrollees into the marketplace plans that are going to drop out of coverage now, already have, or in the future. So we need to have some solutions out there outside of the health coverage options that we have. Because, like I said, I keep on repeating this, pre-existing conditions are going to be an issue for many out there. There's a lot of healthy people out there, but at the same time, we're living longer lives. We're not necessarily living healthier lives, and that affects our health insurance exposure that most of us have. Couple more deals on this article with CNBC. Many Americans are feeling the financial pain following the expiration of the enhanced federal subsidies. 1 in 10 people, or 9%, were enrolled. We just brought that stat up a minute ago. With the subsidies gone, Affordable Care Act premiums are expected to more than double in 2026. Well, we saw that. We saw these premiums just absolutely skyrocket. For the example they're given here within the article, it's showing 2025 premium average 888 a month, basically doubled to 1904. So lapsed in the premium tax credits led to health premiums to more than double in the average enrollee of 2026. More than 90% of the ACA enrollees received those subsidies last year. That was a big shock. And I think people that just auto renewed their plan, we had many of them with our clients that didn't reach back out to us. Even we were trying to be proactive, phone calls, emails. Our carrier portal was updating and sending updates. Hey, we probably want to review. This is the time the past couple months, not necessarily February, January, but February and March. Hey, Justin, I'm getting charged this for my plan. What happened? Well, we try to reach you to do a review to see if we need to make a change. Just because you auto renew doesn't mean the premium's going to stay the same for the following year. And some of those premiums, depending on the carrier, were significantly higher off of that. So, a couple more things on the CNBC article. The anxiety over higher healthcare costs comes as Americans deal with issues of affordability in other areas. The war in Iran, initiated by the U.S. and Israel on February 28, has driven up gasoline prices and threatens to raise inflation for groceries and other areas of household budgets. Okay. I'm seeing on these articles, and there's so much noise out there about this, $7, $10 a gallon. Man, if we start hitting that, no question, people are going to possibly drop their health insurance that they might not have already tried to drop because they wanted to keep it in place. But when you're having to commute your family members or to work back and forth or travel for your job, that's going to have a huge impact on that, and it'll it'll be interesting to see how everything plays out over the next few months or maybe even weeks right now, based on what we're seeing. I don't want to get political, but no question that war in Iran is going to have some repercussions that's going to make the situation that our clients are in regarding affordable health insurance that more desperate and needing help with that. So let's see how everything plays out. Um, to go into the Republican comment, I mean not Republican, but the political comments that they're bringing on this article. While Democrats tended to blame Republicans and vice versa, independents were more than likely to say congressional Republicans and Trump deserve a lot of blame. Um, with the situation we're in right now, I can understand that because I see how many people are hurting, and I see it from other agencies and the news articles that we're seeing around the country. Um, Households make financial trade-offs. I think this is important to talk about. They basically put together a chart on estimating increases in the Affordable Care Act policyholders without enhanced subsidies. And they take a 60-year-old couple. They're not there at 65 to be Medicare eligible, which could be less expensive or more expensive depending on your financial situation. But those premiums might have been you know, $18,000 a year, and then they bump up to $22,000 a year. Okay. And it's going to be depending on income. That's on an $85,000 a month income. And if you were below $50,000 a year in income, this is huge. Your insurance costs would have been 2,200, 2,240 to be exact on this average. So that just shows that hey, if you're making a reasonable income to keep your lifestyle and keep going in your 60s, $85,000, you're going to pay more for your health insurance. Okay, and it can be significant off of that. I'm going to try to put together some charts to put in with the video if I can. If not, reach out to us and I'll get you the stats and the details on the articles. Um, Total enrollment in the ACA Marketplace plan is expected to fall to 12.5 million by 2028. 2027 will be here before we know it, and into 28, that's a dramatic drop in the insureds in the Affordable Care Act. And when you don't have all those people and those premiums coming in, it's going to dramatically taint the risk pool, and there could be some exposure there. So, you've had some record health insurance enrollment highs. I think last year, actually going into the year prior, 2024 going into 2025, we saw a mad dash of people enrolling in plans thinking they were going to possibly lose the opportunity to get health insurance and get that dialed in. So let's see if we got a few more articles here, and then we're going to dive into ICHRA and Medicaid. Those are not too boring, but they can be boring. I'll try to keep the visit as dynamic as I can. Let's see here. I think we're good on the articles there. There was a Wall Street Journal article, but it was a closed article, so I wasn't able to pull up what I wanted on that. But I think we got what we needed. I'm looking up here right now, and breaking news. This is sad. Looks like Chuck Norris passed away, and that is pretty sad news. That's American icon there. I grew up watching his movies, and it looks like on this update right here, his family just brought that up. I hate to bring bad news, and I'm sure when you see this online, everybody's going to know about it. But and I want to say I saw a blip on the radar a few days ago that he was having some medical situations going on, and that's a famous movie star that I think was a great role model for everybody, kind of that Americana personality. And I'm 47 years old, so I grew up in the 80s and 90s, which I think is probably the best time to grow up. Could be wrong, but that's sad news. So just saw that as I was double checking the articles here. Looks like his family made some comments on it. He lived his life with faith, purpose, and an unwavering commitment to the people he loved through his work, discipline, and kindness. He inspired millions around the world and left a lasting impact to so many lives. I would agree with that. I think that's well said from Chuck Norris's family. Hopefully, he rests in peace. And man, thanks, Chuck, for just giving us some great movies and the symbol of strength that you kind of imposed with all those movies and being a artist expert and an actor. Um, Seemed like a cool guy. I wish I could have met him at some events or something in the past. But let's keep on with the show. My name is Justin Holland with the Mad Insurance Show, making a difference in insurance. I am a agency owner and broker here in San Antonio. The reason we have this show is just to be proactive and provide awareness on everything insurance. We've been talking a lot about news articles on the health insurance industry right now. Seems like every show I've got, updates and news on the cost and issues with health insurance. So I try to make sure I don't try. I don't want to dwell on that a lot, but there's a lot of good stuff and awareness that we try to bring out for that. So, Texas State Insurance Services is our brokerage where we help out with individual health insurance, Medicare plans for those that are Medicare eligible, as well as employee benefits for small, medium sized companies. So, if you're needing assistance with an employee benefits plan, your individual Medicare or individual health insurance, or even alternative coverage options where you might be spending a little too much, and you're relatively healthy and you want to make sure that, we can exhaust every option you have out there, give us a call at 210-880-5316. And the website for Texas State Insurance Services is txstateinsurance.com. And you can complete our contact form or give us a call. We'd love to hear from you. I think we'll provide some exceptional value. We're very busy. We've got a lot of people referring over to us because we're trying to do good work for everybody. But we can typically knock out an initial phone call very quickly and see if we need to do a follow up visit. We'll get you some questionnaires, some details, so we can size up your health insurance situation and what we can do to complement the coverage you have in place, what needs to change, or try to help you with get coverage if you are without coverage right now, health insurance or health coverage off of that. Palmetto Life Group is the division that helps out with life insurance, long term care planning, Social Security analysis to help complement retirement strategies, as well as retirement options. We're real excited. I bring this up every show and brought it up earlier. The auto, home, and commercial lines, as well as umbrella policies, are something that we've added. Just a matter of time. We do good work on the health insurance side of the business. And I got to be honest, a lot of these carriers are no longer compensating us on some of the health insurance products that we offer. We don't want to leave people hanging. So we ask, hey, keep us in mind for other lines of business. And so we can keep this growing, invest in the company, provide that service for the years to come. So if you needed help with your auto, home, umbrella, or even commercial lines of insurance, let us know. And our team and myself will help you put together a plan to help you out with that. The number for Palmetto Life Group is 877-357-5316, where you can visit us online and fill out a contact form at palmettolifegroup.com. So we just wrapped up a handful of articles that I wanted to bring up over the show. And I am going to want to visit and talk about Medicaid. And some people qualify for Medicaid, and I'm talking Medicaid, not Medicare. And there's a lot of confusion. A lot of individuals get shocked when they realize that they're Medicare eligible and they've got to pay a $202 Part B premium. And they're like, what is this, Justin? I thought Medicare was free. Well, yeah, some aspects of Medicare are no cost, but make no mistake, there's typically premiums or insurance coverage that needs to be put in place to help you with making sure you've got all the exposure covered. God forbid something comes up. So one of our partners sent over some really cool stuff, and if you need information on Medicaid as it relates to Medicare or individual health insurance, let us know. We'll get you some details and information. From what I can tell, and I did a training last week with a carrier, they dived into the Medicaid and Medicare scenario. I think the jury's still out on some of the final rules that CMS is trying to enforce or create within the industry. But a lot of times, it's income driven. Okay. The only way you get Medicaid is based on a much lower income than the average citizen. And you want to make sure, and you can actually get bumped out of Medicaid. And again, I could probably do a whole show on this, but I wanted to go over the levels of Medicaid and the bullet points of those. So anybody listening to the show or wants to reference it online can do so. Now, one sheet that I'm looking at that we put together, Medicare Savings Program for the year 2026, they have tier levels. They've got QMB, they've got SLMB, and that's M as in Mary. That's QI1, QDW1, and LIS. Okay. And even for agent brokers like myself that have been in this business a while, it's still confusing. Even other sideline agents and brokers that I talk to or work along within the industry, you know, they're exhausted by this. So if it exhausts us as agencies and brokers, and we're in this insurance market every day, we live and breathe it. That's saying something that the consumer probably doesn't have a full understanding of what their Medicaid benefits look like. So give you some examples here, QMB, which is that higher level of Medicaid, helps pay for your Part A deductible, your Part B premium, which right now the entry level is $202. So that's a couple $1,000s a year right off the bat. Deductible and coinsurance. Okay, and in my basically my cheat sheet here, the income needs to be at below 1350. Okay. Um, so that's very low income per month. All right. There's other aspects. I brought up all these other opportunities for assistance. Let's go all the way down to the LIS that I just brought up. Those are non-dual eligibles. Just so we're clear, dual eligible on Medicare is you qualify for Medicare, A and B, but you also qualify for the state and federal assistance through Medicaid. Okay. And some individuals are not complete duals, but they can still qualify for some assistance, granted that they are between 135 and 150% of the federal poverty level. So it gets confusing. You want to make sure that you visit with somebody to outline if you qualify for Medicaid. We've got some great resources to where we can actually size up. A lot of people don't realize that they actually qualify for a dual benefit, and we can very quickly get some information from a client and size that up. Some individuals should qualify for a dual eligibility, but they just don't know where to begin on their Medicare and Medicaid coverage search. And we have some people that we can get you dialed in with to be able to submit an application and see if you qualify for dual eligibility. Because that savings, maybe not for yourself listening to the show here online or over the radio waves, is you might have a neighbor, you might have a family member, you might have a parent that is struggling with their costs of their Medicare, and based on their income, they could qualify for Medicaid and get significantly lower premiums, or just have it wiped out altogether for their Medicare Part B and other services that come with some of the dual eligibility plans. Okay, I'm not going to go into the weeds on that, but let's break down the um, the levels of the Medicaid a little bit more detail here. Texas Medicaid programs, I brought up a minute ago, the MQMB, Medicare Qualified Medicaid Beneficiary Full. Okay, that is the highest level of Medicaid that you can qualify for to get assistance to complement your Medicare. And basically, the beneficiary is a member of the Texas Star Plus program and a MCO, Managed Care Organization. Medicaid level is equivalent to QMB plus. So when you're QMB, you're basically labeled QMB plus. That way, it's a marker for the insurance companies to know, hey, we can give them value added benefits in agreement with the Medicaid program. So let's talk about what QMB does. It helps pay for Medicare A premiums and helps take care of the Part B premiums. Most cases, there's no Part A premium, by the way. Deductibles, co-insurance, co-payments for services and items of Medicare covers, and you get extra help for paying for prescription drugs. That can be huge for those that are taking higher tier medications. And listen, Medicare has done a great job. I got to tell you, when they dropped that maximum out of pocket limit on prescription drugs from 8,000 to 2,100, it was 2,000 year prior. That was huge for so many people to get affordable prescription drug coverage. So that's a big part of this Medicaid program that can complement your Medicaid. Another thing to understand is that if you're entitled to it in 2026 and you have a special enrollment to enroll, basically if you're qualified for it, they allow you to special election period enrollment, and that's going to get you into a DSNP plan that you can get with a Medicare Advantage plan through a carrier. DSNP is dual eligible special needs plan, and what happens there is you've got your Medicaid, your Medicare, and that Medicare Advantage plan is actually managing the coverage and care. Now, where we're going to see a lot of changes is some carriers are aligned with Medicaid better or in a better position than others. Okay. That could be United, that could be Molina, that could be Community First here locally. So it's very important that you stay in tune if you're Medicaid eligible and Medicare eligible, that you visit with an agent like ourselves to make sure that, hey, any change is coming because it might make sense to go to another carrier. Okay. You might be perfectly fine where you're at, but based on the changes that we're seeing, you want to make sure you're prepared. So that was QMB plus. Let's talk about QMB full. That's basically QMB, qualified Medicare beneficiary full. Let's talk about what that does. It also helps with the Part A premium, which typically doesn't apply, your Part B premium, which is helpful, deductibles, co-insurance, and co-payments. Um, Entitled to a 2026 special enrollment. But if you notice, or you can't notice because I'm looking at it right now, there's no additional prescription drug coverage help on that, like what you got with the QMB Plus. So you could qualify for QMB with a program and plan, but still have to pay some higher premiums, not even premiums, so to speak, but copays for your prescription drugs that you have access to. Now, I brought up Texas Managed Care Organizations, MCOs. Now, the carriers that I'm seeing, and I've got a map here, and I can get you a map of which carrier has the Medicaid contract. I've got this colored map, lays everything out, but the carriers that it looks like that have the Texas Health and Human Services Medicaid contracts are going to be United Healthcare, Amerigroup, depending on the market, Molina Healthcare, Community First Health Plans. Looks like they're just specific to Bexar County. Superior Health Inc., which has multiple counties around Texas. El Paso Health and Community Health Choice Texas, which is in the Harris County area. So it's important to know that you might be on a carrier with a dual plan, and it might make sense to look at another carrier on a dual plan. So And um, we've got that list and map that I can give you that shows, and this is effective September 1st. This map could change going into the 2026 new year, depending on the changes they're making. But we absolutely have the data to let you know, hey, what are the Medicaid providers here? What can you do to possibly get yourself, a loved one, or a neighbor or family member covered with Medicaid to complement your Medicare? It's just a process, and you want to make sure that you rule that out if you think income wise that you would qualify for that. So I'm going to go over a couple other things here. Um, again, there's a lot of data on the Medicaid dual eligibility. I kind of gave you an idea of the multiple plans or tier levels that we've got, which there's one, two, three, four, five, six. I'm sorry, five of them. And we just got to size up the situation and see if you might qualify for Medicaid and Medicare. And you can give us a call at 210-880-5316 or visit us online at txstateinsurance.com and we can take a look at that for you. Okay, I am going to dive in to ICHRA. Okay. And I'm going to pull up some slides here to share over the radio waves. It just closed out on my laptop, so I'm having to pull it back up real quick. But this is something that I think is definitely going to um, become a larger segment of insurance. I think it's underutilized, and I think I'm hoping or optimistic that we'll see more legislation for tax credits, to influence or implement ICHRA opportunities for um, for the ICHRA movement in the health insurance industry. So ICHRA 101 and CMS just did a training on this yesterday. Wasn't able to stay on the entire training, but the very beginning of it, and I pulled some slides and some details that they provided just so we can take a look at what the arrangement would look like or what parameters you've got to consider if you're looking at an ICHRA. So, ICHRA is an individual coverage health reimbursement arrangement. It is a type of health and reimbursement arrangement, HRA, that allows employers to give the employees tax exempt money to buy their own health insurance instead of offering it through a traditional group. So, let's process that right off the bat. Individual coverage health reimbursement arrangement, ICHRA. So your employer, or you might be an employer watching this video, or an employer, listening to us on the radio. You're going to be able to say, "Hey, I am exhausted on having to battle these renewals every year, and the rates keep on going up, and we have claimants that provide exposure to our plan collectively, and it collectively raises the premiums for everybody." This ICRA is just going to say, "Hey." The employer is going to give you an allowance and you're going to go purchase the individual health insurance that you want. Okay. And there's different aspects on how you can do that. Some from some companies I'm seeing, they're like, hey, we want to focus on the marketplace plans. But I think you're going to be able to get other insurance and have a reimbursement arrangement on that outside of the traditional marketplace ACA plans. That'll remain to be seen. But the employee receives an allowance to cover the cost of the premiums and the other qualified medical expenses. So basically eliminates having to do group enrollments, and everybody's going to all your employees are basically going to go out and shop for their own individual health insurance, and you give them a reimbursement off of that. Employers can choose to extend the ICRA offer to cover employees, spouses, and dependents. So it's not just subject to the employee. They can be more generous and say, hey, we're going to extend this to help cover the cost for the other dependents for that employee if they would like to. Reimbursements are tax free, meaning they are not subject to federal income tax or payroll taxes for the employees that are deductible for employers. Employees can use their ICRA allowance to enroll in individual health insurance purchased on or outside the marketplace, which is good. We can help you with that. Medicaid's Part A insurance, hospital insurance, and B insurance. Now, typically there's no premium on A, but there is a premium on B, and the ICHRA can help offset some of that. If the employee's on a Medicare Advantage plan, okay, they can enroll in that and get a reimbursement on here based on the data that we're seeing or the parameters, which is pretty cool. So the ICHRA is going to help complement those individuals that are under 65 and is also going to complement those that are over 65 that are currently on Medicaid, or I'm sorry, not Medicaid, but Medicare, and getting on to their individual plan. Employers may group employees into classes. This is pretty cool for those employers that are watching this or listening over the radio. You can basically create classes and offer each class in an ICHRA allowance. Classes are defined in federal regulations and include salaried workers, full time or part time workers, as well as seasonal workers, etc. Employers are not allowed to offer individuals within the same class of employees the choice between traditional group coverage and an ICHRA. However, they may offer one class of traditional group coverage and another class in ICHRA. So let's process this. You may offer one class of a traditional group coverage and another class of ICHRA. So let's say you want to offer ICHRA uh, to all of the staff, or collective employees for the company. But you've got a leadership division of managers and ownership that you want to offer a traditional group plan for. It looks like we can do that, which is pretty cool. Now, keep in mind, depending on that group coverage, if we're not bringing in the rest of the employees to spread that risk, that could tilt one thing over the other. But again, that's going to be a case by case basis. And I'm going to be anxious to help my clients really dive into the ICHRA and say, hey, listen, maybe we do a couple employer classes to where we can have some on ICHRA and some on a group plan if it works out. We want to make sure we pass this through the ICHRA consultants that we've got, but this could be creative on helping lower cost and also provide the coverage that those that are expecting the coverage. Employers set ICHRA contributions with no limits, and the employees cannot add their own money. Okay. Perks of the ICHRA for employers. Let's talk about that. Employees own the insurance. Okay. So it's portable if you think about it. For some reason, the employee is no longer there. There's no transition into Cobra. They just keep that coverage in place. They choose the plan that works best for them. Let's talk about this perk for the ICHRA for the employees. Employees will maybe they don't like the group insurance, or maybe some doctors are not offered in the coverage and care that they're looking for, where they're going to have the ability to go shop, 100 something individual plans out there that might have the doctors and medications they're looking to have covered and get creative on possibly having themselves on one plan and their family members on another. The health insurance coverage is portable. I just brought this up a minute ago. So if an employee leaves the company, they don't lose their health insurance coverage. Okay. So that's pretty cool too. The employee keeps their insurance even if an employee allowance stops. So that's nice. Tax advantages. Employer contributions are not taxed, nor are they taxed as income for the employees. So, huge incentive on this ICHRA that we need to talk more about with small, medium, and large size companies. And I think we're going to see ICHRAs grow over the years. I think we're going to see an impact coming with them. And those are just a couple, just teasers of what to consider an ICHRA for. If you want some details, you want me to share what we saw on CMS, some of the carriers, some of the opportunities. If you want a quote, if you want to say, Justin, we have a group health insurance plan, but I heard you can possibly get creative on having both a group option and a ICHRA option if we have classifications within the company. Let's talk about that. And you can reach us at txstateinsurance.com, complete our contact form there for Texas State Insurance Services, or call us directly at 210-880-5316, and we can dive in and see if an ICHRA is good for you. The other reason, and if you're just tuning into the show, I was talking about Medicaid and Medicare. Again, if you've got questions and want to see if you qualify for both Medicaid and Medicare based on income parameters, or it might not be for yourself, but it might be for a loved one, a family member, let's dive into that and see if there's a qualification there and a special enrollment period that you can take advantage of. But it's a matter of just getting with the right individuals to help you see if you qualify for that. But those are the two industry topics that I really wanted to dive into outside of the news articles that we talked about at the beginning of the show. But I cannot thank y'all enough for joining us today. If you're just tuning in right now, it's the Mad Insurance Show, making a difference in insurance. I'm Justin Holland with Texas State Insurance Services, a local insurance agency that focuses on Medicare, individual health, and employee benefits. That number is 210-880-5316, or you can visit us online at txstateinsurance.com. We would love to help you out. Thank you for joining us on the show today. Hopefully, it provided some value and a little bit of insight. We can only get so much crammed into the show. So if you got questions, reach out to us online or by phone. And don't forget, like and follow us on our Mad Insurance Show on YouTube, youtube.com/at Mad Insurance Show. And we'd love to see you make some comments and articles on the videos that we're posting online. Thanks, everybody. Y'all have a great weekend, and we'll talk again next week with a guest.